Thank you so much. Assalamu alaikum, ma'am. Thank you so much for
Walaikum salam, you're welcome.
agreeing to be part of the interview. So today we have with us Dr. Lubna Chaudhry. She is an associate professor at the Binghamton University, the State University of New York, and most of her work centers around the themes of human development. So, ma'am, my first question to you would be: well, first of all, ma'am, I have a very vivid memory of yours when you came to PIDE in 2015 and presented work on the Christian community residing in Pakistan. So we have that connection with you. So we'll come to that in the later part of the interview about the
Sure.
pandemic being whether the pandemic is a rich man's disease or the poor man's disease, or what sort of inequalities the pandemic is creating or will have the implications for the world inequalities in general. But ma'am, since you are living in US, so what is the state of the statistical state of the virus in the country, and can you draw some parallels
Sure.
with public health?
I live in New York. I live in New York State, and
Yeah.
but thank God I don't live in New York City, which is like the topmost producer of the virus right now. So in US, the United States of America, on the whole, the deaths have been 14,000 and 802 people have died. But in New York City alone, 4,755 people have expired because of the virus.
Yeah.
So, and that compared to that in Pakistan, we've only lost 63. So I think this is a virus that has impacted the first world in a way that it hasn't impacted the third world yet.
Mhm.
And the impact on the third world also is because of the negligence of the first world,
Yeah.
because they keep on sending their people around. They haven't recalled some of their delegates, and in Africa especially, people were sent there and from across the Mediterranean, and that's how the Africa got the COVID-19. So in America, what's interesting is that the COVID-19 epidemic or pandemic, but it's an epidemic in New York. The pandemic has shown the inadequacies of their healthcare system. That their healthcare might be one of the best in the world because they can do open heart surgery very efficiently, but it has shown that that's all that they can do really well,
Yeah.
that their healthcare system is not even good for the middle class, let alone the working class. A lot of people at this point in time don't have health insurance, and they can't even afford to go out and get tested. So the numbers are probably much higher than what we see reflected in the news every day. So and the American situation, economic situation, and I'm not talking about the Wall Street situation, I'm talking about the situation of the everyday lives of people,
Yeah.
is really has also been shown to have a lot of fault lines. A lot of people, with the lockdown situation, the stores have shut down and a lot of people work in those stores. Restaurants and bars are only working part-time. They're only working as now food suppliers. You can go and pick up food over there, or you can get food delivered, but you can't eat in them. So the people who used to work there, like waiters and waitresses, no longer have jobs. The rest of America, though, the middle class America in some ways hasn't suffered because they have been allowed to work from home and they are still getting paid. But still, there have been some layoffs. So, but the really hardest hit have been the poorest of the poor,
Yeah.
who don't have access to healthcare and who also don't have access to food security.
Yeah, and that brings me to that very pertinent question, which is very much part of the concurrent debates around in the first world as well as in the third world countries as well. That how to reach out to the vulnerably poor segments of the society. So, has there been a state policy in the US to reach out to these people to identify the poorest of the poor and to facilitate them in the situation of the complete lockdown?
Well, some organizations have been working, and the president of the US, who in itself let the situation get so worse before he announced a stimulus package, which would be, out of which money would be given to small businesses, and some money will be given to the poorest of the poor for food. But that's not enough. It's just money to cover them for a few days, for a few weeks, maybe at the most. So that process hasn't kicked it into being yet. People are still being identified, and businesses are still being identified, so God knows when the money will get out to these people. And in America, although we don't have the same level of bribery that we have back home in Pakistan, but over here there's also corruption, you know, on a larger scale. So the corruption that happens in the US is of billions of dollars. So with the stimulus package has raised many questions as who's going to do the distribution, who's going to take care of the money. So these are questions that are not quite clear, that will the money really reach to the people who really need it?
Yeah.
So yeah, that was a very good question. And I have no answer for it because there's no knowledge being dispersed. There's no information being given about how the money is going to reach the people that really need it.
Yeah, ma'am. And for this is for something because we have been interviewing for quite some for time up till now, and one of the important things that come out of the interviews is that the nature of the pandemic is so rare and so new that we are learning along the way to what needs to be done in the situation of the partial or the complete lockdowns. So, ma'am, one of your areas of interest is the human development, a very pertinent one. Um, how do you think that the pandemic has or is shaping the human behavior in the wake of the social distancing and the institutionalization of the policies which are based on social distancing? So, do you see human behavior being changed or people resorting to the state policies of social distancing? What is the situation out there?
I think in Pakistan, there has been more resistance to social distancing, but so has there been in the United States. They had to bring out trucks in parts in New York City and in parts of the country in California, so in order to scare people into staying at home. So that I think people initially, it didn't strike people that this was a big issue. They said this is just another flu, like H1N1, the bird flu. People raised a lot of hue and cry a few years ago. I think it was in 2008 and 2009. And people were really scared of it, but it didn't do that much damage. So people just thought it was another pandemic of that sort. But they didn't realize that this one kills. And this one kills certain vulnerable groups, which are children under the age of 5 and older people. So actually a whole generation is being wiped out in the United States.
Yeah.
And so now people are scared and trying to listen to the social distancing has worked now. People are in their homes. And what thing has worked for the middle class is that we are still being paid. I work in a university, I teach here, and I went online with my classes, and this is how I learned Zoom for the first time in my life. And but I get my salary. My husband, he works for the corporate sector. He's getting his salary. He's working from home. Um, but I just found out, I was just talking to my cousin in Pakistan, and her husband works for a very good private school, and everybody is not getting their salary. They just stop giving them the salaries. So the difference between here and Pakistan is that Pakistan is the middle class is also being harder hit by the lockdown. And I don't think social relationships in Pakistan, I don't think are going to suffer in the long run. We are very close people. We are intimate. But I think in the United States, when the pandemic started, people started to misbehave to people of East Asian origin.
Yeah,
So
there is that for dimension to it as well. Yes, yes, yes.
yeah, and now it's said in New York, oh, it's New York, it spread so quickly because most people over there are immigrants and third world people, and they live too many of them live in the same house. So that's the excuse that people are giving for what's going on in New York, instead
Yeah,
of the healthcare owning up to its lack of. I mean, we don't have enough tests. I
yeah,
mean, they don't have enough tests, they don't have enough ventilators, they don't have enough masks. So instead of owning up to their inadequacies, they are blaming the immigrants. So I think what's going to happen with this pandemic is that those fault lines in society that already exist there between different groups of people are going to get more heightened in the United States.
and ma'am, one of the important for debates is also that there are certain social spaces where where such people reside who at one point in time are not able to provide sustainable livelihood for themselves and for their families. And those are also the people who are residing in the social spaces which are extremely tight and closely knit. For
Exactly.
example, the informal settlements or the slums or the smaller communal groups and areas. So it is one of the important debates that those are the people and those are the social spaces which are highly susceptible on economic front and on the epidemiological front. Um, and this is the debate which is very much part of the political discourse in the South Asian countries. So as an expert, have you identified or do you identify certain social spaces existing in the US as well, where people are generally more susceptible to behaviors that can lead to have a higher number in the pandemic?
I mean, I'm not an expert at all in the pandemics, but I have been forced into the situation to learn more about it. Yeah, there are social situations. I mean, for instance, immigrant houses are too close to each other. A lot of them do reside together, and for a long time they didn't close down the schools in New York, talking about social spaces, and so some of it spread through that. And then uh, there are also grocery stores in New York City are places where people interact socially, so those are still open. And although people wear masks, but they have known to be not so very good prevention mechanisms. So people still go there, and what they say is hang out in the US, hang out with each other a little bit. They say it's just a little bit, but it's enough for the virus to keep on going.
Yeah, yeah. So, ma'am, my last question would be that as an expert in human wood development and in wood development for studies and in human rights and wood development, what do you think should be the swift things or the checklist of things which needs to be done?
I don't have a checklist, but one of the main things that different governments need to do is to kind of look at the fault lines in their healthcare systems and start fixing them. Because otherwise, pandemics are going to keep on happening. I mean, this is like the first one that's happened, but it seems like we are becoming more prone to them. So we need to fix our healthcare systems so that they are accessible to the poorest of the poor and the marginalized of the marginalized. And that's our first priority, I think. So I don't have a checklist, but that's definitely, I mean, social distancing is not on my checklist. I don't think it's a healthy situation. I mean, over here in the United States, a 1-year-old got the virus and he was taken away from his family and put into isolation. I mean, that can kill a baby by itself. So social distancing itself is actually per se as a way to force people into getting better or force the society into getting better is okay for a few days, but it's not a long-term remedy. The long-term remedy lies in fixing the healthcare situations around the world, like the first world, third world divide, and then within the first world and the third world, the third world has a first world, and the first world has a third world within itself,
Yeah.
you know.
Yeah.
So the third world, as in our Pakistan, has people who can buy the country. You know, some people have so much, and it's time they opened up their coffers to help out the country. You know, and then over here too, like there's the third world. In the first world is the responsibility of the people in power, and that responsibility has to be taken if they want the votes in this election. So that's one thing I think that's pushing the president to take some steps, is because he wants the votes. So the election in some ways is a good thing that's happening this year. I don't know how they are going to manage the election with all this social distancing, but we'll see. But I think that it's a good thing that the election is happening this year. Otherwise, I don't think we would have seen any stimulus package or anything like that.
Okay. Thank you so much for your time, ma'am. Thank you so
Oh,
much.
you're welcome, and it's good to talk to you. Keep in touch.
Same here, ma'am. Same here. Thank you, ma'am. Thank you. Thank you.